Hi Professor, my name is Harjashan Kaur. My student ID is 120905245. Here is the 360 view of my room. I am going to start the procedure head to toe assessment. Performing hand hygiene. Hi.
Hi.
What is your name?
Amandika.
What is your date of birth?
April 17 2001.
Can I check your wristband?
Okay.
Thank you. My name is Harjashan Kaur. I am your registered nurse for today. Today I am going to perform head to toe assessment on you as per doctor's prescription.
Okay.
Are you comfortable?
Yeah.
Maintaining privacy. Firstly, I will perform neurological assessment on you. I will ask you some questions you have to answer. Okay. Do you know where you are?
In the hospital.
Okay. What is the time now?
It's 9 p.m.
Okay. What is your mother's name?
Manpreet Kaur.
Okay. The patient is oriented to time, place and person and there is no sign of confusion. Moving forward, I am checking your eye. Okay. You have to focus on the wall behind me. Dimming the lights. Checking the right pupil by flashing light. Left pupil. For consensual response, I am flashing the light on the right eye, checking the opposite eye. Flashing the light on left eye, checking the opposite eye. Okay. Now for accommodation, you have to focus on the tip of my finger. Okay. Pupil is equal, round and reactive to light and accommodation. Now moving forward, I will assess the facial drooping. Can you please smile? Can you please clench your teeth? Tighten your eyes? Raise your eyebrows? So there is no sign of facial drooping. Now I'm going to assess for slurred speech. Can you please say light, tight, dynamite?
Light, tight, dynamite.
Okay, so there is no sign of slurred speech and stammering. Moving forward, can you please stand up for pronated drill? Can you please place your hands like this? Close your eyes. Count for 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, now you can sit. There is negative pronated drift. Moving forward, now I will assess the respiratory system. Okay, I'm checking your anterior and posterior chest. Can you please deep breathe? Okay, so there is no use of accessory muscle. On inspection, I can't see any kind of bruises, lesions, and any edema, redness. So can you please move backward? Checking the chest, posterior chest wall for expansion and retraction. Can you please deep breathe? Okay. So there is no sign of retraction. Expansion is good. Breathing is non-labored and there is no use of accessory muscles. Okay, now I am assessing your lung sounds for any adventitious sounds. Whenever I place diaphragm, you have to deep breathe and please do not speak in between. Please move backward.
Yep.
Starting from the backs of the lungs. Okay. I had assessed 6 landmarks on the anterior chest and 8 landmarks on the posterior chest. But there is no any abnormal sound like wheezing, stridor and crackling. Can you please sit stable? I am going to assess your cardiac system, okay? For which I will assess your heart valves. Firstly, aortic valve, which is at the second intercostal space, okay? Toward the right border of the sternum, parallel to it, at second intercostal space toward the left border of the sternum is pulmonic valve. Erb's point, which is at the third intercostal space toward the left border of the sternum. Tricuspid valve, which is at the fourth intercostal space toward the left border of the sternum. Mitral valve toward the left medioclavicular line. Here I am going to assess the apical pulse for 30 seconds. Starting now. normal, rhythm is regular. I can't see, I can't hear any S3 and S4 sound. S1 and S2 sounds were normal, loud. Now moving forward, I am going to assess your abdomen. Can you please lie down? Firstly, I will inspect your abdomen. First, assess your abdomen for any abdominal distension, symmetry, and skin for any redness, blisters, visible mass, lesions, but I didn't find anything. Abdomen is flat, there is no abdominal distension. I'm going to assess the bowel sounds by auscultating, starting from right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, there is not any hyperactive and hypoactive sounds. Bowel sounds were normoactive. Now I'm going to palpate your abdomen. You have to tell me if you feel any pain. I'm palpating the abdomen for any kind of redness, any kind of visible mass, lesions, any herniation, rigidity, tenderness, but I didn't find anything. Did you feel any pain? Okay, thank you. Now moving forward toward integumentary system. I'm checking your skin for any kind of, checking the skin temperature. Side by side, I'm assessing the skin for any kind of edema, pallor, any bluish discoloration, lesions, bruises. Checking bony prominences for any pressure ulcers. Okay. Okay, skin is warm to touch. There is not any abnormality in your skin. Checking your nail beds for capillary refill. As I can see, capillary refill time is less than 2 seconds. There is no any bluish discoloration and any discoloration. Okay, checking skin turgor. I'm going to pinch your hand. Skin is retracting back, as you can see. So there is no sign of dehydration. Okay, now I am going to palpate your pulses. First is carotid pulse, which is present at groove between the trachea and sternocleidomastoid muscle. Okay, same on the other side. Strength is pulse plus 2. Pulse is palpable. Now moving forward, I'm going to assess your posterior tibial pulse, which is behind the medial malleolus. Strength is plus 2. Pulse is palpable. I'm going to assess the dorsalis pedalis pulse, which is present between the first and second metatarsals. Okay, pulse is palpable. Strength is plus 2. Can you flex your arms? Extend, flex your legs. Extend your legs. Okay, can you please sit? Okay, you have to push your hand like this. I'm going to push towards you. You have to resist. Okay, can you please squeeze my hands? Okay, I'm going to put force against you. You have to resist me. Can you please again? Okay, so the muscle strength is plus 5. I didn't find any abnormality in muscle strength. So this is my procedure. Here is a 360 view of my room. Thank you.